Hey, Dr. Kenneth DeLay here, board certified urologist practicing in West Columbia, South Carolina. I use this channel to educate my audience on issues relevant to urology, men's sexual health, health policy issues, and other healthcare musings that come up. If you enjoy what you see, please like and subscribe and turn on notifications so that you can see future content as it is released. So today we're going to talk about delayed ejaculation or difficulty reaching orgasm and reasons for having less volume of ejaculate. Low ejaculate volume just means less fluid is coming out. There are difficulties finding a formal definition for delayed ejaculation, but it consists of a few things, and this really is the inability to consistently obtain orgasm in a time that the man finds reasonable and non-distressing. Some men with delayed orgasm are not able to reach orgasm or climax at all, while others can only do so after a period of time that they consider concerning to them or their partner. So before we get started, let's talk about what orgasm is and how it occurs. Orgasm and ejaculation usually occur together in men, but are separate processes. Orgasm consists of the intense physical and psychological sensations that occur at the climax of sexual activity. Signs of orgasm usually include changing facial expression, increased heart rate, and the contraction of pelvic floor muscles. This is separate from ejaculation, which is the expulsion of fluid from the urethra or male urinary channel, and this fluid contains sperm and other nutrients that facilitate the fertilization of the female egg. There are a number of common disorders which affect one or both of these processes, and we're going to go through each of them now. 1. Low testosterone. Testosterone is both necessary for both orgasm and the production of ejaculate. Ejaculate comes from the prostate and seminal vesicles, as well as a very small amount from the testes. The prostate is a gland which surrounds the male urinary channel, and the seminal vesicles are paired glands sitting right above the prostate, as seen in this picture. Most of the fluid coming during ejaculation comes from the prostate and seminal vesicles, more coming from the seminal vesicles. Only 10% or less comes from the testicle itself. Both the prostate and seminal vesicles are dependent upon the production of testosterone for their healthy existence. If testosterone levels decline, men have trouble reaching orgasm and can have a decreased volume of ejaculate or fluid that comes out. A second problem that can occur relates to surgery. While there are a variety of surgeries that can affect ejaculation, the most common surgeries are those that involve the prostate or surgeries that affect the nerves which stimulate orgasm. Because these nerves are in the back of the abdomen and pelvis, a variety of abdominal surgeries and pelvic surgeries which are in the retroperitoneum can affect difficulty with ejaculation. A third area of trouble can be medications. SSRIs, which is an antidepressant, and finasteride can both cause problems. Finasteride is a drug actually used for an enlarged prostate and works by affecting testosterone metabolism. In some patients, it causes difficulty with erection, orgasm, and lowers the amount of fluid produced during ejaculation. For this reason, I try to avoid prescribing this in young, sexually active men. SSRIs are the most common type of antidepressant used in the US, and these affect serotonin levels in the brain. Because serotonin receptors in the brain are involved in orgasm, some men who take these medications have difficulty reaching climax or orgasm. A recent study suggested about 30% of men are affected by this side effect. If you were affected by this, it would be important to discuss with your physician before stopping the medication. For most patients with anxiety or depression, alternative medications can be used which wouldn't affect orgasm or ejaculation in the same way. A fourth area which can cause issues is thyroid dysfunction. Although we don't understand exactly why, we do know that both high and low levels of thyroid hormone can affect a man's ability to reach orgasm. This can be checked with a simple screening blood test. The fifth area of problems are psychosexual, and these can include anxiety and depression. Anxiety and depression affect men in the bedroom very frequently, and this can be associated with both erectile dysfunction and trouble reaching orgasm. Treatment can involve a combination of sex therapy, cognitive behavioral therapy, as well as medications in some cases. A sixth area of problem is hyperstimulation, or what we call idiosyncratic masturbation patterns, and this can affect the ability of men to reach orgasm when having intercourse with their partner. What happens here is because masturbation is done in a way which is so unique and so different than what the sexual stimulation patterns that come from vaginal penetration are, men don't feel adequately stimulated during intercourse and have trouble reaching orgasm. So this can be treated with sex therapy and certain retraining techniques. 7. Aging. A large study called the Multinational Study of the Aging Man looked at men aged 40 to 70 and studied both ejaculatory function as well as urinary symptoms. Interestingly, as men age, they develop more urinary issues and have less volume of ejaculate and more difficulty reaching orgasm. The reason is complicated, but it's likely because men who become older have more medical issues, take more medication, and have less penile sensitivity. And finally, there are idiopathic causes of trouble with orgasm and ejaculation. This last category means we don't exactly know what's going on here. It may have to do with penile sensitivity or other issues which aren't really easy to study in clinical settings. The treatment for less volume of ejaculate or difficulty reaching orgasm depends on the cause. In some cases, the cause may be permanent if it's associated with surgery. In other cases, removing the offending medication or circumstances can help. Sex therapy can be helpful if the trouble is caused by hyperstimulation or psychosexual causes. And if we can't identify the cause, we do have medications that can help. Almost all of them, however, are off-label and have not been approved by the FDA specifically for this purpose, although there are studies to suggest their effectiveness. This is a complicated topic, and if you think you're having difficulty with orgasm or having less ejaculation coming out, seeking the care of an expert in sexual medicine in your community may allow you to identify the cause and regain your function. I hope this content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released. Thanks for watching.